YouTube. In this video, we're going to cover extrapyramidal symptoms, also known as extrapyramidal side effects, also known as extrapyramidal syndrome, also known as EPS. These are a collective of symptoms that patients may experience in response to taking their antipsychotic medication. So before we get into what extrapyramidal symptoms are, we're going to briefly go over antipsychotic meds so you can have a basic understanding of their nature. Then we're going to talk about each extrapyramidal symptom in detail and how they're treated. So let's get started. Antipsychotic drugs, previously called neuroleptics, are used primarily to treat symptoms of psychosis, such as delusions and hallucinations seen in schizophrenic clients, psychotic depression, schizoaffective disorder, the manic phase of bipolar disorder, and drug-induced psychosis. Other indications for antipsychotic drugs include aggressive behavior, anxiety, insomnia, and the disruptive behaviors that accompany Alzheimer's disease. Short-term therapy of antipsychotic drugs may be helpful for acute psychotic symptoms seen in borderline personality disorder. Antipsychotic drugs work by blocking the receptors of the neurotransmitter dopamine, which are the same receptors that are thought to be associated with mental illness. Now, there are three types of antipsychotic meds: first generation, also known as conventional; second generation, which is also known as atypical; and third generation. However, the first generation antipsych meds are the most potent, making them the most effective, but the most likely to produce extrapyramidal symptoms due to its blockade of D2 receptors. But this does mean that extrapyramidal symptoms are less likely to occur in a patient that's taking this class of the drug. Usually the atypical generation is what they'll switch the client to if they're experiencing extrapyramidal symptoms as a result of taking the first generation meds. Also, this generation inhibits the reuptake of serotonin, which is the same mode of action found in some antidepressants, making second-generation antipsychotics very effective in treating the depressive symptoms of schizophrenia. Third-generation antipsychotics are also called dopamine system stabilizers. These drugs are thought to work by stabilizing dopamine output, meaning they retain or enhance the production of dopamine when it is too low, but reduce its production when it's too high. This allows the patient to receive a control of symptoms without experiencing those harsh side effects associated with antipsychotic meds. Third-generation antipsychotic meds have been successful in treating both bipolar disorder and depression. Currently, the only third-generation antipsychotic is aripiprazole, also known as Abilify. Headache, anxiety, and nausea are the most common side effects that have been reported with this drug. Now, keep in mind that these extrapyramidal symptoms can still occur with any generation antipsychotic med. It's just that the first generation antipsych meds have a greater incidence of EPS versus the second and third generation meds. The other major side effects that could occur with antipsychotic meds are neuroleptic malignant syndrome, tardive dyskinesia, or anticholinergic side effects. And there are other side effects that may accompany antipsychotic meds aside from the ones mentioned, but today we're going to discuss extrapyramidal symptoms. Extrapyramidal symptoms, or EPS, are one of the major side effects that clients may experience in response to taking their antipsychotic medication. These neurologic symptoms occur from a blockade of dopamine D2 receptors in the mid-region of the brainstem. And as we just said, extrapyramidal symptoms are most likely to be seen in first-generation antipsychotics versus second and third generation. Also, remember that it's extrapyramidal symptoms with an S at the end, because this is a collective group of three distinct symptoms. Those three distinct symptoms are acute dystonia, pseudoparkinsonism, and akathisia. So let's talk about each extrapyramidal symptom in greater detail. Okay, so first let's talk about acute dystonia. This is an extrapyramidal symptom that will cause the patient to experience muscle rigidity, muscle cramping, and a stiff or thick tongue. And some of these manifestations of acute dystonia can cause complications of their own. For example, muscle spasms and stiffness can produce torticollis, which is when the head and neck are twisted to one side. Aposthotonus, which is tightness of the entire body with the head, back, and the neck arched. Or oculogyrate crisis, which is when the eyes involuntarily roll back into a locked position. Then the thickness and stiffness of the tongue could lead to the client having trouble swallowing, laryngeal spasms, as well as respiratory difficulties. Acute dystonia is most likely to occur in our patients that are within their first week of antipsychotic therapy, our male patients, patients that are 39 years old or younger, and our patients that are prescribed high-potency antipsychotic drugs, such as Haldol or Nevane. Now let's talk about how acute dystonia is treated. Acute dystonia is treated with anticholinergics, such as benztropine mesylate or Benadryl. Now take a minute to think about these acute dystonic symptoms that the patient is experiencing. They have a swollen tongue which can obstruct their airway, muscle stiffness, muscle cramping. I'm sure these symptoms are very scary for the patient as well as painful. So we're going to try to get rid of these symptoms quick. We want to administer these anticholinergics intramuscularly or intravenously because these medication routes are going to give the patient a quick relief of their symptoms. Now, after we administer these anticholinergics, the benztropine mesylate or the Benadryl, whatever route is prescribed, the physician will usually add an oral anticholinergic to the patient's medication regimen that they can take on a regular. Adding this oral anticholinergic to the patient's regular medication regimen will keep those dystonic symptoms away while still allowing them to take their prescribed anti-psych meds. Now, let's say the doctor adds this oral anticholinergic to the patient's medication regimen and it doesn't help their symptoms. The patient would most likely be prescribed a lower dosage, or the physician would change the patient to an antipsychotic drug that's less potent than the one that they're taking. Okay, next, drug-induced Parkinson's or pseudoparkinsonism. This is another type of extrapyramidal side effect of antipsychotic medication. These symptoms resemble the same symptoms we see in patients with Parkinson's disease, such as a stiff, stooped posture, a mask-like face expression, decreased arm swing, a shuffling gait with small steps, continuous muscle stiffness, drooling, bradycardia, tremors, pill rolling movements of the thumb and fingers, ratchet-like movements of the joints, and akinesia, which is when the person has trouble initiating voluntary movement. Pseudoparkinsonism is treated by changing the client to an antipsychotic medication that has a lower incidence of EPS. It may also be treated by adding an anticholinergic to the client's medication regimen. And then there's amantadine. Amantadine is a dopamine agonist that increases the transmission of dopamine. Because if you guys remember back from earlier, antipsychotic drugs work by blocking that transmission. And the last extrapyramidal symptom to be discussed is akathisia. Akathisia is characterized by restless movement, pacing, and the inability to keep still. The client reports having an intense need to move around, so they may appear to be anxious and agitated. The person with akathisia may also have a rigid posture or gait. Akathisia can be treated with a change in antipsychotic medication. It can also be treated by adding a beta blocker, a benzodiazepine, or an anticholinergic to the patient's medication regimen. Okay, ladies and gents, that wraps up extrapyramidal symptoms. Please be sure to like, comment, share, and subscribe. And as always, thank you so much for watching.